She recently won an important research grant to examine different models of affordable rental housing. After Catherine, we'll hear from Linda Wilson. Linda has worked with people living on the margins of society in Halifax since 1984. After 5 years with city planning in Halifax, she worked as a frontline worker at Adsum House, and then became executive director of Phoenix Youth Programs for 8 years, while she also was completing her bachelor and master's degree in social work at Dalhousie. She later became the executive director of Homebridge Youth Society, an NGO serving youth in care, while she was also teaching as an adjunct professor at Dalhousie. Linda is currently the executive director of Shelter Nova Scotia, which annually serves approximately 1,200 marginalized people at risk of experiencing homelessness, are currently homeless, or are in the process of transitioning out of homelessness. And our final presentation is by Jeff Karabanow, sorry, Jeff. Jeff is a professor of social work at Dalhousie University. He has worked with homeless young people in Toronto, Montreal, Halifax, and Guatemala, and is one of the founding members of Halifax's Out of the Cold Emergency Shelter, and co-director of the Dalhousie School of Social Work Community Clinic. His research focuses primarily on housing stability, service delivery systems, trauma, and homeless youth culture. His latest research focuses on the impact of COVID-19 on the homeless community. In 2019, Jeff was awarded the Senate of Canada 150 Medal. Following these presentations, we will hear from three frontline panelists. Karabanow, director of the Jane Paul Centre in Sydney, which is associated with the Canadian Native Women's Association. Trish McCourt, executive director of the Tri-County Women's Centre in Yarmouth. And finally, Sheri-Lecker, executive director of Adsum for Women and Children in Halifax. Our panelists have been asked to reflect on what they heard from the presenters, and as both service providers and strong advocates for the populations they serve, to also bring their own insights and experience to bear on some of the issues raised. So welcome to all of you. Please note that everyone other than the speakers and panelists will be automatically on mute during the webinar, but you are invited to make comments or ask questions in the chat app at the bottom of your screen. Our very capable technical host and president of the Action Coalition, Alex Stratford, will keep watch and pass over some questions for me to put to the presenters or panelists if we have time at the end, and I hope we do. So without more ado, over to you, Catherine.
Okay, thank you very much, Stella. I'm just going to share. That's still disabled my ability to share my screen. I'll try it again. I can share only the host.
You should have that capacity now. Okay,
it's asking me, it says who can share. So should I select all panelists? Or no, I'm the host now, right? Okay. So Alec, I just see here, it says who can share, and the options are only host or all panelists. So I select all panelists, is that right?
I would think that would work, Catherine, and then just share your own screen.
Okay. Okay, thank you. Okay. I select those and then it's not letting me share.
Okay, backup plan. I'm gonna put the slides up and share from my screen, and then if you just want to let me know when you want me to move through, we can do it that way.
That's great, thanks a lot. It's funny, you know, I'm teaching only online these days, and we're using Teams, and I always have problems with the screen share as well.
That's why we thought that and knew we might run into some problems. So
Not a problem.
One sec there.
Okay, so I'll let you pull up those slides, and I just want to thank you all, thank the organizers, and thanks for the opportunity to present this evening. Of course, I am presenting, but I think everyone involved in the session tonight has as much experience as I do with these interrelated topics of affordable housing and homelessness. I do want to especially acknowledge those of you on the panel who will be speaking about things that I don't address in my presentation, including mental health and domestic violence. So I lastly want to acknowledge before I begin that I'm presenting tonight from Unama'ki, which is land of the fog and is unceded Mi'kmaq territory. So you can go to the next slide. So I was asked to speak tonight about the policies or the lack of policies that have gotten us to where we are right now in the middle of the pandemic. Of course, it's really serious issues around affordable housing in our province, and homelessness were being experienced before the pandemic began. So for example, if we look at core housing need data, we know that 28% of all of our renter households are in core housing need in our province. Core housing need tends to capture affordability. So you're in core housing need if you're spending 30% or more of your household income on shelter costs, and also to be in core housing need, a unit in your community of average cost that is suitable for your household size would also cost at least 30% of your household income. So core housing need generally captures affordability, and it's not experienced equally across all of our renters in the province. So we know, and this is based on our last census, that 42% of lone parent renters are in core housing need. 37% of people who are living alone without dependents are in core housing need, and 32% of our Indigenous renters are in core housing need. So a problem before the pandemic began. We don't have data on racialized groups in core housing need, but data from the census suggest that African Nova Scotians also disproportionately experience core housing need. And I say this because of their lower household incomes. African Nova Scotian workers earn lower wages, and they're more likely to be unemployed. Next slide, please. So also pre-pandemic, people were experiencing homelessness, and our homelessness data have an overrepresentation of Indigenous people and racialized groups. So we did a count here in Cape Breton Regional Municipality in 2018. That was a 30-day count, and we identified 278 people experiencing homelessness. In HRM that same year, they did a point-in-time count and found 220 people experiencing homelessness. And that same year, there was a rural study done in some of our counties on the other side of the province, including Shelburne and Digby and Yarmouth. They found that 30 people were either sleeping rough or were couch surfing. Next slide. So that was, the trends before the pandemic. These have been exposed and exacerbated through COVID-19. I just wanted to share with you a couple of slides based on a survey that was done just last month with our local COVID working group. This working group consists of mostly frontline service providers like the Ally Center and community cares, but there are also public health staff who are members of this working group as well. And it was public health staff who analyzed the data, and community organizations collected it. So they surveyed 115 individuals who are using the services of these frontline organizations. So these are vulnerable members of our communities here. And 43% of their respondents, and they had 115 respondents, said that their housing situation has changed since March. And the reasons they identified included being evicted, becoming homeless, using the shelter, and facing increased rents or rental costs that were too high based on their incomes. Next slide. One of the questions that people were asked is, which of these situations became harder in your life since COVID-19? And I just pulled out the most common answers for you. So people reported increased feelings of loneliness and disconnection. People said it was harder for them to manage anxiety and stress and depression. Over half of respondents said it was harder for them to find housing or a place to stay. They also said it was harder to get to and from places, and that they had problems accessing services and supports. So again, you see high numbers of poor housing need and homelessness, and then you have the pandemic, which makes it so that people in our communities find it harder to find housing, and they're increasingly worried about becoming or being evicted and experiencing homelessness. Next slide. So how did we get here? So again, I was asked to identify some of the policies or lack of policies and other things that have led us to this point. And so we got here in part because of colonization, because of the trauma and abuse from the residential school system that Indigenous people have experienced, as well as placing Indigenous children in our foster care system. We know that people who go into foster care are more likely to experience homelessness. We have a chronic underfunding of Indigenous housing on and off reserve. This has led to inadequate supply of housing in major need of repair, and crowded housing conditions as well. And of course, Indigenous people face discrimination in the rental market. Next slide. We also got here because of inadequate incomes. And so I've presented two sources of data on this slide. So on the left-hand side, you see income assistance that are received compared to our rental costs. And so what I've done is I've pulled out income assistance rates for individuals who live alone and who don't have disabilities. So I believe the amount they get is $586 per month. Those are the blue bars. And the orange bars are average rental costs in 4 communities in the province: CBRM, HRM, Queens County, and Truro. And as you can see, the orange bars are higher than the amount of income assistance people are receiving, particularly so in HRM, but we see this across these communities. These are rents, average rents for 1-bedroom apartments only. I didn't include studio apartments because we basically don't have enough of those to include them in the calculation. So we see inadequate incomes in terms of income assistance versus rents. And of course, these are just rents that I'm reporting. Income assistance is supposed to cover all costs that people have to live: rents, heat, lights, food, clothing, transportation, telecommunications costs, and we see just including rents puts those costs over income assistance rates. On the right-hand side, I've pulled out information on rental wages, or the weekly hours that a person is required to work to pay for their rental costs if they're renting an average cost 2-bedroom apartment. This is work that was done by the Canadian Centre for Policy Alternatives. They published a report last year. They published data on our major cities across the country, so that included HRM. So I asked my research assistant, Aija Deng, who's on the call this evening, to calculate these figures for CBRM. So we see that in Halifax, one needs to work either 78 hours per week at minimum wage. That's when the minimum wage was $11 a couple of years ago. Or they need to be earning $22.57 per hour. If they're in CBRM, they need to be earning $14.94 an hour, or they need to be working 54 hours a week to pay for their 2-bedroom apartment. We all know that in CBRM, our jobs tend to be part-time. Next slide. So we also got here because of lack of investment in affordable housing stock. So this is an issue that I think we're all familiar with on this call, so I'm not going to spend too much time on this. Even though we had a re-engagement in affordable housing funding in the 2000s and the 2010s, it wasn't until the launching of the national strategy that we had significantly more money invested in affordable rental housing stock. But even then, the NHS is behind on its targets. So I know that, we had the announcement of the Rapid Housing Initiative today, in part because we're behind, the NHS is behind on its targets. But this has been acknowledged in the Recovery for All report written by Steve Pomeroy, that we are not keeping up with demand. And there are also two mechanisms that the NHS has in place that haven't been organized yet. So in the National Housing Strategy, they announced that they would have two mechanisms in place in order to monitor progress on the National Housing Strategy and also monitor progress on tenant outcomes. And those are the National Housing Council and the Federal Housing Advocate. And those haven't been established yet. That's also very important. Our provincial action plan on affordable housing really has quite modest targets. If you look at new builds, it really emphasizes the preservation of stock. Preservation of social housing stock is of critical importance, so please don't misinterpret what I say. They're investing in repairs, they're investing in making units more accessible. These are critical. But we also need new affordable rental housing stock, again, to match what is going on in our communities around inadequate incomes, high levels of core housing need, and homelessness exacerbated through the pandemic. So all of this lack of investment in affordable rental stock means that most of our rental housing stock in the province is unsubsidized. So I think people have this misconception that if you have a low income and you're renting, you have an affordable housing unit. It's somehow subsidized by government. But the reality is that most of our renters are living in unsubsidized housing. Next slide. The last thing I want to say as far as how did we get here is that there's really been a lack of emphasis on public and nonprofit and cooperative housing providers. Public housing has become a much disliked model of housing delivery. We like to focus on what is wrong with public housing and not with what is right about public housing. Public housing is a deeply subsidized, long-term investment in public housing. And so, again, it's important that we're investing in the existing stock. But like some of you have already pointed out in things that you've written and statements that you've made to the public, we need to invest in more public housing. New public housing units can be scattered across our communities, across our province, and we can also provide more supports in our existing public housing communities. In the province of Nova Scotia, our nonprofit and cooperative sectors are also very small. And there has been a recent lack of emphasis on provider type. So what kinds of organizations are providing public housing? Don't get me wrong, for-profit landlords have always provided rental housing in this province, in this country, but we've had policy periods where the emphasis has really been more on nonprofit and cooperative housing providers. And we saw then after the federal pulling out of affordable rental housing in the 90s, and then when they re-engaged modestly in the 2000 and 2010s, we saw partnerships being developed with social economy providers, but also with the private for-profit sector as well. And this is to create affordable housing. That's concerning. I've looked quite carefully at this and collected a lot of data on housing providers in the Cape Breton context. And we found here that our nonprofit and cooperative providers and community development corporations providing affordable housing charge lower rents than market-based landlords. And this is when we look at units that aren't receiving subsidies from government. And if you look at research from the United States, where they compare the partnerships that the government has had with market-based landlords to the partnerships that they've had with nonprofit landlords, when the agreements between those parties expire, market-based landlords increase their rents and nonprofit providers don't. And so one of the reasons we're here, I think, is because we have lost this emphasis, although I do think things are changing with the national housing strategy. So this means that right now in Nova Scotia, most of our rental housing is provided through the marketplace. There's also an unwillingness to intervene in that marketplace. So there isn't really even an interest to discuss possible interventions to mitigate the effects of a rental housing market when most of it is provided by the private sector. And by this, I'm thinking about bans on evictions, and I'm thinking about things like rent control. So I know I'm running out of time, so I'm just going to move to one more slide here. So what can be done to change? So in addition to, you know, the policies I've identified that have gotten us to where we are today around inadequate incomes and not enough funding for affordable housing and not enough emphasis on public and nonprofit and cooperative providers, there's something else I think that we can do to achieve some change, I think. But I do want to point out that I think that there are some really good things happening. So on the one hand, I have days when I feel quite discouraged about the progress that we've been making in Cape Breton around affordable housing, reducing the number of people in core housing need, and really addressing homelessness here. But I also feel positive about the tremendous emphasis in the media around these issues. In local elections, affordable housing was often discussed. Tenant groups, you know, especially in the Halifax area, are very vocal in the issues and the challenges they're facing. So I think that's a positive. We also, in this province, I think we have strong national allies, like the work that's being done by the Canadian Alliance to End Homelessness and CHRA. And there are really, even though we haven't achieved this yet, there are also really strong calls for Indigenous-led and Indigenous-focused housing strategies. And we're also paying much needed attention on issues of race and reparations to African Nova Scotians. So the one other thing I have, I guess, the one other idea I have for change is, can we be better connected across the province? Do you think it's necessary to be better connected across the province? I do. I think that in our regions, we're making some headway as far as convening different stakeholders and understanding more the nature of the problems that we're facing around these interrelated issues. I'm thinking about the Affordable Housing and Homelessness Working Group. There's a working group in the Port Hawkesbury area. Of course, there's a group in HRM, and then in the other side of the province as well. And surely there's more happening than that. But can we link those more regional efforts better? And I'm sorry I've taken more time than I should. Thanks.
Well, thank you, Catherine. That was really informative and also very challenging at the end. And perhaps we can come back to those questions at the end if we have time. I hope we do. So you raised a number of issues and given us a lot to think about. Now, before I turn it over to Linda Wilson, I'd just like to remind participants that if you want to ask a question, make a comment, please use the chat. It's being monitored, okay? So Linda, it's over to you.
Okay.
Linda, we're going to do the same thing with your slides too. So
All right. Okay.
let me know when you want me to slide through. I'm going to share them right now.
Okay. Put the first one up, please. Very good. Okay, thank you. Thank you, Catherine. That was very, very interesting, and I think it's a good lead in for me. I'm going to talk about the realities that we're seeing through our organization. But to begin with, I'd like to thank and send my admiration to all my colleagues at Shelter Nova Scotia who are working carefully and thoughtfully through COVID-19 pandemic to keep our clients, their colleagues, and themselves safe. It hasn't been an easy time, and they are at it 24 hours a day. I'd also like to thank our partners in the community and the government, most specifically Phoenix Youth Programs, Salvation Army, ADSM for Women and Children, the North End Community Health Center and their Mobile Outreach Street Health Team, Public Health, the Affordable Housing Association of Nova Scotia, Out of the Cold, and the United Way for working with us and our clients to find solutions and safety for the folks we serve and all involved. It's been a very complicated and scary and trying time. So in March, the Canadian Alliance to End Homelessness made a very simple statement. The best protection against COVID-19 is a home. It's not complicated, but it's very complex. So thank you for the opportunity to speak a bit about these issues this evening with my panel of informed professionals. I'll speak broadly and then specifically about some of the work at Shelter Nova Scotia as it relates to housing and homelessness in our organization. It's become accepted and understood that a housing-first approach to ending homelessness is the way to go. The old ways of people having to prove themselves by applying for jobs and getting employers to sign documents saying you've dropped off your resume or staying clean and sober for a certain amount of time or going to detox before you could be considered for housing is no more. It's now understood that by transitioning from homelessness into a stable home, a shift in perspective can occur. So when people are no longer in day-to-day survival mode, because they have a place to call home, they can move forward. We all can move forward to envisioning a different future. Next slide, please. So when life circumstances evolve to a point where a person can no longer has a place to live, they can experience homelessness. There are broad causes of homelessness and specific reasons a person could experience homelessness. I won't go through them here because I think this group knows what they are, but they're there on the screen. Next slide, please. And next slide, please. There are more specific reasons, and Catherine mentioned some of them, like the child welfare system, youth offender centers, mental health systems, addiction systems, military life, migration from rural communities, hoping for a better life or a fresh start. And there's all the societal stigmatization, stereotypes, and discrimination resulting in social isolation because of mental health barriers, substance and or gambling dependency, and a lack of adequate services, race, faith-based practices, age, sexuality, gender, and national origin. And the solution to everything, or the problem with everything, I guess, is the shortage of affordable supported housing. Next slide, please. I think people know too that Canada has been using some definitions to describe states of homelessness. There are transitionally homeless people, episodically homeless people, chronically homeless people, and those who are the hidden homeless. Next slide, please. Maslow's hierarchy of needs is always something that I find makes it easy to explain to people because so many people are aware of this hierarchy of needs that was developed by Abraham Maslow. So with this in mind, you'll understand that most often when we meet people, they aren't even at the bottom level. They are below the bar. They don't have food or water or a place to sleep. They often have no belongings and are wearing all the clothing that they own. Often all they have connected to this measurement tool is, as you can see, the bottom there says breathing. All they have is air. They are breathing. They have no sense of safety or love or belonging or self-esteem. It's not to say they've never had that or they never will again, but at the time of experiencing homelessness, most people are very alone. Next slide, please. So I'm going to tell some short stories here. Barry House is an emergency shelter operated by Shelter Nova Scotia. And pre-COVID, this was the situation. We supported women and women with their children and trans individuals who are experiencing homelessness. There were 20 people sharing 6 bedrooms. Next slide, please. The guests were 16 years of age and older. They could be singles, families, youth, senior citizens, people living with mental health concerns and disabilities. They could have been unemployed or underemployed. They could be struggling with substance misuse, post-traumatic stress, abandonment, rejection, and poverty, and all the things that we know. Barry House had bunk beds. Next slide, please. In July 2020, our occupancy was reduced from 20 to 17. Public health determined, thank you, Jesus, that appropriate social distancing cannot take place with bunk beds. Although overcrowded shelters have seemed to have been accepted as a necessary evil, it's not appropriate for all the reasons. So during COVID-19, we changed our model and we now have 17 what we're calling snugs. There are a maximum of 3 per room, and what they are sleeping areas, as you can see there. They have 3.5 walls. The walls are 4.5 feet high, and there's 1.5 feet of plexiglass attached to the walls. Our basement was waterproofed to build 5 more snugs, which gave us the total of 17. And what that has meant is we've lost our family area, a family space that we've provided. So we're no longer able to serve women with children because that privacy has been lost. The upside is people are getting better rest. It's more dignified. It's easier to sleep. It's cleaner. There's less tension because everybody has their own areas and they have their own lockers. So it's much calmer and nicer and safer and cleaner in the shelter. Next slide, please. Metro Turning Point is a shelter also operated by Shelter Nova Scotia. Pre-COVID, Turning Point supported 55 men and trans individuals sharing 2 dorms. Next slide, please. It also was full of bunk beds. Next slide, please. Next slide, please. So in July, we reopened with a reduced occupancy from 55 to 30. Again, no bunk beds. This time we have 30 snugs, which created a more appropriate guest to staff ratio, which is now 1 employee for every 10 people, which has given us the opportunity to do much more intentional work with our clients. And again, there's better rest, it's more dignified, it's easier to keep clean, there's less tension, there are all kinds of great things about it. Next slide, please. And if all I had to worry about is what was going on in the shelters, there would be no worries. But what it has meant is we're turning more people away. So you can see, to begin with Metro Turning Point, from October 5th to the 18th, we turned away 44 people. There were 215 requests for shelter by 44 people. You can see the reasons that they were turned away. 2, because they did not fit our mandate. 5 were on our do not admit list. But 209 times employees told people that there was no available bed, that we were full. People were seeking shelter because of discharge from the hospital, from other shelters, from corrections, evictions, but the main reason was chronic homelessness and a lack of housing. Next slide, please. Barry House, same period of time, October 5th to the 18th, turned away 23 people. They received 55 calls. And the reason they were turned away, 1 person didn't meet our mandate, 3 were on our do not admit list. 49 times the employees told people there are no beds available, and now that we no longer serve children or people with children, we had to turn somebody else away. The reason they were seeking shelter was discharge from hospital, discharge from income assistance supported hotel was 2, discharge from corrections 1 with no plan, eviction 3, and chronic homelessness, the lack of housing, 39. Catherine mentioned this, sorry now, not being in charge of my own slides. I'm getting my notes messed up. The point in time count that took place in March and April in 2018. And of course, there was supposed to be another one this year, but it didn't happen. It had to be postponed, but if you're interested in more information like this, you can go to the Affordable Housing Association of Nova Scotia and look on their website. Find their report called Everyone Counts, a report on the 2018 point in time count. Next slide, please. So we offer some supported housing. We do have some, we certainly don't have enough. This building is called the Rebuilding. It was named by a client who said that people are rebuilding their lives. The tenants there have experienced episodic or chronic homelessness. The units are permanent housing, and some units have become transitional for those who are able to live with less support after stabilization. Next slide, please. This is what they look like. 19 one-bedroom or bachelor apartments. And we have a case manager on site 16 hours a day and on-call support 24 hours a day. Next slide, please. Heron Cove Apartments is a real housing first, I guess you could say both of them are, but this is a real housing first program. It provides stable, supported housing for people with alcohol dependency who have a history of chronic homelessness. Next slide, please. There's capacity for up to 12 tenants. It's staffed full-time, around the clock, and providing on-site support. Next slide, please. Our dream is when we look at best practice, evidence-based research, we would like to see a triaged approach using housing first principles and integrated services. So you can see here, Children Nova Scotia has a vision that we will eventually offer a service that includes all these things. It would require lots of partnership because, of course, we don't have expertise in all these areas, but we do have a lot of expertise in emergency shelter and supported housing. Next slide, please. So although we've got some good services, we don't have enough. It's not nearly where it should be. We've always used words like crisis and emergency and undignified and disrespectful to describe what's happening to people when they go to a shelter. And then, of course, there are some people who refuse to go to a shelter because it's just too tough to be inside. Shelters are not the answer. At Shelter Nova Scotia, our dream is Metro Turning Point, which once had 80 beds, would have 10 beds. And they would be very short, really short-term emergency beds, and there would be enough housing that people would move through those beds so quickly they would be housed quickly. And what COVID-19 has done is shine a brighter light on the issue. Overcrowded shelters would not allow people to self-isolate, and that created chaos and fear and a temporary crisis response, which was very noble and worked for a while, but it certainly wasn't sustainable. And here we are, and we don't have a solution. We weren't ready, and we can't go back to overcrowded shelters ever. People have to have a place to live, and affordable housing and supportive affordable housing is what is needed. We are participating in lots of conversations and potential collaborations with government entities and community agency partners. We're trying to figure something out, but it's not easy. And there needs to be a really short-term response, an immediate short-term response, and a longer response, long-term response. And certainly Catherine touched on a lot of that. Thank you.
Thank you, Linda. That was great information, and great information, but disturbing information. So thanks. Just to let everybody know that the presentations will be available on our website when the recording goes up there. Alex will be putting those up there tomorrow or soon anyway. So I'm sure lots of people have lots of questions. So just keep putting them in the chat app there, because I know I have lots of questions. So now we go on to Jeff Karabanow. Jeff, would you like to start your presentation now?
Sure. Thank you. Thanks you for the invite. And thank you, Catherine and Linda, for all the work you do. It makes me proud to listen to the phenomenal stuff that you two have been doing. So thank you. I'd also like to kind of echo Stella's note that to acknowledge that we're all located on unceded territory, the Mi'kmaq. We're treaty people. My heart goes out to those Indigenous communities in the Southwest right now, the province facing such violence and racism and terror. This discussion is more of a reflective piece, perhaps a cathartic piece as well, maybe a cathartic for myself. We're living in extremely surreal and challenging times, and life is extremely difficult for so many. Deep racial injustices, environmental strife, rise of political and economic chaos have become the backdrop or maybe the forefront with a global pandemic that has in many ways amplified such injustices and abuses. And this talk today is about the impact of COVID on homeless populations, which is the focus actually of my current research that's looking at disaster relief and recovery. And the pandemic is certainly a massive disaster, but so is homelessness in itself. And that's, I think, if I have a core argument, that's it. COVID has rearticulated and impacted, but it hasn't caused this situation. The pain, the injustices, the inequities, and abuses of being homeless is and should be considered a major disaster. It's a failing of our society. It's inconceivable that a rich country like Canada should ever have people living without shelter. It's a major violation of human rights. It's a social justice issue. And what COVID perhaps has influenced is that now homelessness is seen as a health issue. Lots of my research is focused on how young people become homeless and also how they exit homelessness. And while this is not the focus of the talk, it's safe to say that those findings, my findings, and the majority of findings out there, place structural and systematic dynamics as the core etiological stressors rather than the myths of personal pathology. And I think those have been articulated eloquently by both Catherine and Linda. And we can certainly extrapolate kind of the research I've done with young people to other populations within the homeless sector. We need to move away from blaming people for living in poverty or pathologizing or criminalizing or surveilling them. But we're talking here about COVID and its impact on homelessness. So I thought I would do that in a bit more of a narrative sense by walking through the story of Out of the Cold Emergency Winter Shelter. Out of the Cold originated 13 years ago through a collective of homeless organizations and activists worried about the ensuing winter and the lack of low barrier harm reduction based last resort options for people in need. We become a community-based volunteer run emergency winter shelter that embraces a trauma-informed harm reduction and a low barrier service delivery model. Before COVID, kind of like how Linda framed her work with Turning Point and Berry House. We were at Out of the Cold, the December to April voluntary run space at St. Matt's Church, seeing approximately 50 to 60 folks each night. We were a last resort for those looking for a bed for the night, meaning if you couldn't go anywhere else, you were welcomed with us. Most of those nights we had 15 to 20 to 30 cots set up. And then the 30 plus extra folks who came each night were seeking food, security, clothing, a sense of community, a sanctuary for the night. There was just nothing else available. We had few staff each year, but we engaged approximately 150 volunteers each year that did everything from cooking, laundry, evening, overnight, morning shifts, etc. Everything to set up and to provide that sanctuary space. It was a way to build truly a community-driven model, and also to sensitize the public to issues of housing, employment, poverty, mental health, addiction, and all those systems that work around this. So last year, we were housed actually at the Native Friendship Center when the province declared a state of emergency. And we quickly redeveloped the new service, a safe space, physically distanced 10-person shelter, each person in their own tent pod. No drop-ins any longer, which broke our hearts. We had to provide safe supplies and food at the door. Soon after that, with the province and public health consistently remarking that we needed to stay home, wash hands, self-isolate, physically distance, there became a clear realization that some segments of the population are not afforded those opportunities. Opportunities of home, being able to separate, being able to wash. For a group of citizens that rely upon public space more so than others for day-to-day survival, for example, public washrooms, cafes to get a drink, meeting spaces like libraries, or going to services that provide significant supports, everything changed overnight. The whole city shut down. Their world shut down. Much of my research is focused on the importance of street services. So the shelters, for example, that Linda spoke to, the drop-ins, the health clinics, the safe supply services. These are key sites for care, for support, for community, for life. But what people really need is stable housing. And that we need for our emotional, our physical, our psychological, our spiritual well-being. I just finished a study last year looking at how young people, once they've exited the streets, what actual stable housing looked like for them. And we had 2 cases in Toronto and Halifax, and we worked with young people for over a year to track their experiences of actually being housed. It's not surprising that people feel better and feel safer and feel more cared for when they have a home. And this just doesn't exist. And perhaps that's one of the major issues illuminated through the pandemic. We've not introduced policies that could allow for increases in affordable and social housing. There's an excellent report just came out a couple of days ago from Toronto's working group around preserving and protecting deep, affordable dwellings like rooming houses and shared accommodations. We've lost so many of those. So if COVID's done anything, it's to amplify, not uncover, the deep inequities in our society. What a pandemic shows is that when public health is the main engine or priority to containing and restoring and rebuilding and healing, everyone counts. That's what's meant by the public in public health. The only way out of a health crisis is if everyone has the opportunities for safe and healthy place and can abide by the protocols set out by public health. We're also extremely lucky in this province that there was not community spread within the homeless sector. It's actually not just luck, but it's emergency planning to have folks in their own spaces and a coordinated attempt for testing and isolation. And Out of the Cold was one of the first shelters to mobilize into a hotel space. Every one of our guests were provided their own room, their own bed, their own washroom, their own phone. As Linda noted with that language of being dignified, these were dignified spaces to shelter from the storm. Anecdotal evidence suggests, and it's not surprising, that folks felt safer, healthier, more stable, less anxious, and more connected. And this is what my research is going to explore as well, which brings me back to a bit of a rant, which I've noticed that I've been doing for approximately 15, 20 years now. We need better places for those experiencing homelessness. More supportive, more supported housing, diverse housing stock, affordable housing, individual shared accommodations, co-op, urban and rural sites We always speak to this during election time, but then it seems to fall off the agenda. A benefit of the pandemic was the bringing together of amazing folks working in this arena: public health people, provincial government housing folks, nonprofits, shelters, clinics. Every day we spoke to what was happening and what needed to happen. We built a coordinated, rapid response to the emergency at hand. These were extremely anxious times, and there was no blueprint to what our responses should be. So these daily phone call check-ins with the group that I just noted above allowed for a new type of community to form, to support us together through this, and that feeling of not being alone in our own work. We certainly have a passionate, smart, creative group of housing activists working together. And the panel today definitely exemplifies that. But I'm not going to end on a happy note this time, but more with a warning and a reflection. I just reviewed an article about homelessness in San Diego, where around 8,000 people live rough, 3,500 in shelters. We have to deal with this now before our numbers get out of control. It also resurfaces an argument that social work and allied professions have been espousing for decades. Poverty and marginalization are deadly. Here's a population with little connection to civil society, are consistently in survival mode, live in very unsafe and precarious arenas, and are rarely afforded the same opportunities as do regular citizens. During this pandemic, the core public health orders of go home, stay home, self-isolate, physically distance, relax, just didn't work for this population. What about those without homes? What about those who need to panhandle daily in order to meet out basic needs? And actually the move now to cashless society will no doubt be extremely impactful here as well. What about those who are suffering with addiction? Or those who are experiencing increased levels of trauma? Or those who don't have any safe space? Or those who may need to stay in very unsafe spaces? And as we all know, there's been an increase in intimate partner violence during this pandemic. What about those who are alone? COVID-19 has re-articulated the fragility of our capitalist neoliberal ways of organizing society. It's reawoken debate concerning essential employment, precarious employment, societal safety structures, health, work, and deep disparities within our worlds, especially in terms of gender, race, culture, ability, geography, and age. The pandemic has also shined a light upon system strength and failure. Our Canadian federal government was able to roll out emergency basic income to over 300,000 individuals who were out of work and struggling. At the same time, those on income assistance and disability supports continue to survive on meager allotments. Long-term care environments, much like some big city shelters for the homeless, were proven to be poorly funded, poorly administered, poorly staffed, and became deadly spaces of the outbreak. Moreover, while globally we're all weathering the same storm, it became quite evident that people's experiences differed drastically based upon such markers as race, culture, personal safety, gender, ability, socioeconomic status, health, age, and geography. These themes are in many ways at the core of building a better world. Thank you.
Well, thanks, Jeff. You've left us with a lot to think about and certainly a lot of challenges at the end. And I'm sure that there have been a couple of questions already, so we'll continue with that discussion in a few minutes. But before we do that, I'd like to thank Jeff. And now I want to turn it over to the three panelists: Karabanow, Trish McCourt, and Sheri-Lecker, in that order. So we'll start in Cape Breton. So let's hear first from Karabanow in Cape Breton, who I'm sure will have something to say about particular challenges facing Indigenous women, especially there. And then we'll hear from Trish McCourt in Yarmouth, and finally from Sheri-Lecker in Halifax. So Karen, it's over to you. Thank you.
Thank you. So in regards to homelessness, housing issues, it's always been an issue within our communities, whether you live on reserve whether you're off reserve. And the assumption that because you're from the community and you're trying to find housing off reserve, it usually comes back to stating, oh, we can't help you. Your community should help you. But when you're in your community, but if you're not living in your community, they don't have to necessarily assist you. So it's kind of like you're in between playing catch. Who wants to help you and who's going to throw the ball to you? Who's going to catch it and say, hey, I got it and I'll take care of you. So in our communities especially, and we know it's right across the province, right across the world, country, whatever you call it, the systemic racism piece. So again, those barriers that we face as Indigenous people when we're trying to access services when it comes to being off the community again, our language, even though we may be fluent speakers, it's more difficult for us to comprehend what's being told to us in English, whether it's being written in English on a document, whether we have to try to figure out how to respond to what is being presented to us. If we speak English very good, it does not necessarily mean we still understand the English that is being spoken to us. I'm kind of fluent in Mi'kmaq, about 70% approximately, not 100%. The English language, even though I was brought up with it, to this day, it still is difficult, and I still have to figure out what is being said sometimes, and I have to kind of translate that English language into the English I understand, if that makes, and I know that doesn't make any sense to anybody, but it's how we perceive and how we have to translate. So you take an Indigenous person who is a very fluent speaker, trying to translate those English words into some kind of understandable English that only they can understand. And it's not dumbing down the language, it is just making it understandable so that we can understand. So when I read documents and things, there are times I have to go to a dictionary, like, what does that word mean? I don't understand that word, or I don't understand the way that sentence is written. So when someone's giving us a lease, for instance, to read, that's a big barrier right there. So one of the things that we have done at work with the Jane Paul Center, and we've partnered with the Native Friendship Centers, that we have hired a housing coordinator, an Indigenous housing coordinator, that's going to assist our clients that are looking for homes, that are looking for housing, that need that assistance. Maybe they need that assistance for just to find an apartment or a home, or mediation because they're going to be thrown out for whatever reason, and they need someone to help them. So one of the things that we are doing is that support that we've never had before in the city, from the Nova Scotia Native Women's Association's way. So our Indigenous people within the city they do struggle. I've seen them. They are on the streets. Some of them do have apartments. Some do go to the homeless shelters. And some are so far from the main city, they're at least half an hour away from the main city. For transportation is an issue. There's so many things that are barriers to our people accessing services that will be that will help them to grow, to get services, to get to the doctors, to get their groceries, to get whatever it is. Yeah, so those are the things that we are facing in our district, I guess, when it comes to off reserve. Living on reserve, 20 people in the house, that's pretty common. Yeah, you have 20 people trying to share 6 rooms in a shelter. That's 20 people trying to share a 3-bedroom house on a reserve. And sometimes those 20 people are sometimes grandma, their children, their in-laws, and their grandchildren all in one home. And that's very common, you know, the perception that we are given houses, we are given cars, we are giving education, we are given all these things. I've never been given a house. I had a child. I built my own house. I work hard. I wish it was true that they gave us stuff. I mean, you know, I get nothing. I work hard just like everybody else. I pay taxes. I'm proud to say I can do that, and that I have to work hard for it. But not everybody is like me. There are people that have difficulty in accessing or acquiring a great life. Basically, yeah, maybe it is a choice. Maybe it's from intergenerational trauma. Maybe it's from the addictions. Maybe it's from the abuse they suffered that created all these barriers in their lives. So we try to go through a different perspective of saying, you know what, we're going to help you anyway, and we're going to guide you. We're going to do what we can do to help you. Yeah, maybe you will get kicked out often, but you know what, we're still going to be there to help you try to find something that'll work for you. So I think that's where I'm going to end it right there. And again, it's like I said, it's always going to be an issue. Thank you.
Thanks, Karen, very much for that. And yeah, I'm sure there'll be some questions for you too later on. So I hope you're still with us with your probably not very good internet up there as well, I expect. So moving on to Trish. Trish McCourt is in Halifax. Thank you, Trish. So can you go ahead now? Thank you.
Hi, I'm actually in Yarmouth, not in Halifax.
Oh, I'm sorry. Oh, sorry.
That's okay. And the only reason I really bring it up is because one of the things that I really want to highlight is the difference living in small rural communities that are a big distance from Halifax, and how that has an effect on what's available in our community to help people who are homeless or precariously housed. So one of the things that is really important to take into consideration is there's very little, if any, public transit available in our communities, let alone in the rural outlying areas of each of our communities. We also, just within the tri-counties, so Yarmouth, Digby, and Shelburne, have about 10 municipalities, and each municipality, of course, has their own ways of zoning and those kinds of things which affect how housing can be made available for affordable housing. And of course, then there's also the additional cost for services being offered, because when you're in a central area like Halifax, there may be more people that can access that one service, and a lot less travel that's involved in getting to the people who require the outreach. So I just made a couple of notes as I was listening to each of the presenters. Thank you to each of you for the information that you shared. And I just thought I would share a few different unique perspectives that I thought of, or some questions that I thought of. So when Catherine was speaking about rental wage, I was just reminded that we also had that done for Yarmouth, Digby, and Shelburne. And just as an example, in Yarmouth, the rental wage is about $17.35 an hour for about 60 hours per week that someone would have to work at minimum wage. And job opportunities are even fewer and further between in our area than they are even in Halifax. So that's an additional challenge. Housing stock in our area is extremely limited. So not just affordable housing, but even those in middle income bracket are finding it very difficult to find livable housing available. People think that there's a lot of housing because there were a lot of properties that were vacant for a lot of years because of that, you know, people transitioning from the small communities either to the city or even going further west to places like Alberta. But those properties were basically abandoned and not maintained. So there's a lot of properties that are no longer livable that are vacant. And the cost of housing is even higher in those that are available. Some of the properties that do get identified as being available for affordable housing are not in ideal situations at all. So they may be further out of town where they're not accessible to the very limited public transit that is available, if there is any public transit. And that also means that they're further away from the services like healthcare that they might need. And of course, there's also the continued segregating housing between low income and middle income that would happen in doing, in using some of those properties that are available. So there have been properties that have been offered up that through the different affordable housing coalitions have actually been turned down because they're not ideal situations at all to be putting people who are already precariously housed in. That isn't to say that not all the municipalities are trying. There are a couple of municipalities that are working really hard to try to make housing available, but it just is that much harder to coordinate because we have so many different municipalities within such a small population base. So the idea of a unified voice, I think, is great when you think about strength in numbers, but it concerns me because the situation in Yarmouth, for instance, is so very different from CBRM or from Halifax. And I wonder how we can ensure that those unique needs are going to be addressed under that larger unified voice. When Linda was talking about housing first, it brought to mind that there's actually housing money available through what would have been called the Housing First project at one time through the federal government, but it's only available in Yarmouth. So Digby and Shelburne don't have access to those funds, and we don't know how to even make that accessible to them. So we're constantly trying to figure out what we can do to assist people who are outside of Yarmouth. And that also goes to the shelters that are available. So there are only 2 shelters available in the Tri-Counties. Both of them are within the town of Yarmouth. One is Juniper House, which is a transition house. So it's only available to women and children, and only available to women and children who are experiencing intimate partner violence of some kind. And the other shelter is a youth shelter. And so it, of course, also has parameters around age of who can access them. And so then the next option that becomes available is for people to leave their home community in order to hopefully access shelter in a community like Halifax. And so then they're moving away from the few supports that they might have as far as family and friends go. And then we're exacerbating that, loneliness and belonging that really affects people's health in a big way. One of the things that recently came up in our community that was just announced by the province that I think is just going to make the situation even more challenging, even though it's a welcome change, and that is Harborside Lodge, which is an adult residential center in our community, being phased out. And, adult residential centers are probably not the optimal place for adults to be housed. Living in community and small options homes or in assisted living would be a much better arrangement. However, we are already facing this housing crisis in our communities, and I'm concerned about how that priority list is going to have that trickle-down effect. So people coming out of Harborside likely will be prioritized over a lot of people that are on the list for housing now, and so everyone else is going to move down the list and have to wait even longer for housing. So then finally, when Jeff was speaking, it got me thinking about what services are available in our community and how different it looks than Halifax. So SHIFT is the youth housing project in Yarmouth. We had to, of course, so I sit on the board for SHIFT in addition to working with Tri-County Women's Center. So I know exactly how the pandemic affected housing there. And we were able to house most youth that were looking for space, even though we had to reduce capacity by a couple of beds in order to not have some of the issues around social distancing. But one of the things that we saw happening, so one, we had to limit outreach services, so it was only drop off and pick up of things like meals, which in the pre-COVID times would have meant that people could come in and actually have a meal with other youth, and then they would leave again. And so instead they were calling ahead, and the staff of the shelter would make a meal available for them to come and pick up. And the same with laundry services. They would drop off their laundry, staff would actually do the laundry for them, and they would come and pick it up again. But the worst thing that I saw happening was that we were having to evict youth for reasons we never had to before. And that was because they were not able or willing to follow some of the pandemic guidelines. And that meant putting youth residents and staff at risk if they were leaving the shelter and coming back. So what was happening was youth were being forced to stay in-house, and that also meant staying in their room a lot of the time. And so we were creating even more isolation and limits in what people were able to access in the community. Juniper House is the other shelter in Yarmouth, and it's a transition house. And of course, again, we saw a reduction in beds that were available. We also saw a reduction in the programming services that were available, because a lot of those were happening out of the transition house. And in order to protect the residents of the transition house and keep them from being put at risk because of COVID, it meant that the programming couldn't be offered out of the transition house anymore. And looked very different. It would have been services outreach program where there might have been multiple people to come in and get those services made available to them within the shelter. And finally, we did at the Women's Center have concerns about women who we knew were in situations of intimate partner violence, where they were being forced to stay in their home with the partner who was abusing them in some way. And so they didn't have any kind of safe space, and also had the challenge of not having privacy to seek out some of the support they might need, even over the phone. So those are just some of the things that I saw, thought of as the presentations were happening, that are some of the unique perspectives from the Tri-County area that I think are also seen in other small rural communities that are far away from the more metropolitan areas. Thanks.
Thanks so much for that, Trish, and big apologies for saying you were from Halifax after all that, for sure. Yeah, a lot of challenges that you face there. I have to say that I think HRM faces its own challenges, but you know, they're different, right? And that's important to recognize that. So now for our third panelist, over to Sheri-Lecker in Halifax this time. Thank you. Go ahead, Sheri.
Thank you, Stella. First of all, I want to thank all of the eloquent speakers who came before me. It's hard to be last. I think everyone has well articulated the many, many challenges facing us wherever we're living in this province. It's really difficult for me, and probably many people on this call, to have hope when we hear about all these challenges. And so I want to talk a little bit about where my hope comes from. But before I do that, I guess I'm going to add to the challenges, but they are related to hope. I heard from a colleague earlier this evening, and then saw on the Fairview Resource Center Twitter feed tonight that a landlord in Halifax sent out a letter, I think a couple of days ago, not a new story for us. A rent eviction, rents are going up in that building by $650 a unit. So let's just guess that someone's paying $700. The new rents are going to be $1,350. I suspect the rents are more than $700 already. So that's, you know, that's speaks to points made by a number of people before me, including Catherine. So that's one thing. Another challenge, we have what's called a coordinated access system functioning in Halifax, whereby everyone we meet who is homeless, we know them by name. We have their name. We have other information about them as well. But right now, there are a total of 493 people who are on that by name list who are actively homeless. And of that, about 80% are homeless for 6 months or longer. So let that sink in. 390 individuals and families homeless for 6 months or longer. So you could say, well, you know, what are the opportunities in those kinds of numbers and all that you heard earlier this evening? I think there are two things. One is that, as Jeff said, you know, that the idea that home or housing is health is on people's mind. We've heard it from coast to coast to coast. Stay at home. That is the best protection against the transmission of COVID. So the idea that people need to be housed is, I think, being felt more generally through the population. That's one thing. We usually only get that as the weather changes and it gets cold and people worry about where people are going to go if they're outside sleeping under a bench or on a bench or under a bridge. I think the other reason that housing and homelessness is on everyone's mind is that it's expensive for everyone. Right? It's just, we've heard about housing prices are going up around sales. We've heard how, you know, rental prices are going up. It's on everyone's mind. So again, it's this opportunity while people are talking about housing that we can also be talking about those folks who are unhoused. So what are the opportunities? Aside from the fact that it's on everyone's mind, I'm not going to talk about the news today that was unveiled about the new rapid housing initiative, except that we are aware from that Halifax, there's $8.7 million being made available for Halifax. I think we have yet to learn what the rules are around that, but my understanding is that that HRM will have to make a business plan for the use of that money, and that will be toward the rapid creation of housing for persons who are in core housing need. That means that I think by March of 2022, this housing has to be created. They have to be new units. So they could be modular units, or they could be, let's say, commercial spaces that are refurbished and retrofitted. But there is the possibility, there is this opportunity. So one thing would be how best to have input into how HRM will go forward and create this business plan. And the other thing is to just to look at, I saw a question, I think it was Michelle Millette asked, how do you convince the province, or how do we convince the province, and then I didn't see of the need for housing those individuals who may be struggling with their mental health and or substance use. I think that was Michelle's question. I'm not going to speak to that, but what I want to speak to is how do we prove something? How do we affect change in a system? And I want to use an experience that we had at ADSM, but certainly we had lots and lots of input from other organizations and people on the ground here in Halifax. And that was our experience around diversion and families. So we had this idea, we did some reading, we also were noticing at the shelter that we were hearing from more and more women who had no place to go, who could not afford housing, or who were leaving situations of intimate partner violence. And year over year, the numbers were increasing. So we sat down and we looked at the data, and then we started discussing, okay, what could we do? Because we were turning them away. Linda talked about how demoralizing it is for a shelter worker, but also, you know, the impact that it has on the person who calls or comes to the door to say, no, we can't help you. We don't have space available. So we did some reading, and Claudia Jan was also very much involved in our conversations. And we came up with this idea of trying to avoid a stay in shelter altogether. Now, what would that look like? What does diversion actually look like? And so we came up with a plan, and we shopped it around to governments at all levels. We presented it, and everywhere we went, people were really interested in the idea, but there was no money for it. So we got a private donation, and we ran a very small pilot. And I remember it was just over 3 years ago when we started, and there were a very few families involved, but we started. And we had part-time staff working some hours a week. And the idea was that instead of a family ever coming into shelter, we would settle them in an apartment that we rented, and we would work with the family around all of the needs that they were experiencing. And we would work with them around where they wanted to move to. Where was their housing of choice, if there were children going to school or daycare involved, where their traditional supports might have been. And the idea would be that the family would stay in the apartment that we rented for a period of time while we worked with them to find a permanent solution. And then the family, after 2 months or 3 months, would move into what they saw as their permanent solution, their permanent rental housing, and we would move another family into the apartment that we rented. And we did that for the first year with a small number of apartments and a relatively modest amount of money. And as we started to have outcomes and results, we were able to attract more support, and initially federal government support. And then when we were able to show the results and outcomes of the second year, we were able to bring the province on board. And so now we have a situation where we have a well-funded program. The goal is to prevent children from having a stay in shelter, or if having to stay in emergency shelter, minimize the length of the stay because it's good for everyone, because there's rarely space for a family in shelter, but also because we know that there are preventative effects of never having an experience in shelter ever. So we're 3 years in with this. We've worked with over 80 families, over 150 children, and of, I guess, about 250, 275 people involved, 84% of the children have never had a stay in shelter. They've experienced homelessness, as in they didn't have a place to go, but they never stepped into an emergency shelter. They went into an apartment, and then from that apartment, they went either to another apartment or we signed with the landlord's approval, we signed the lease over to the family, and we found another apartment to rent where we could cycle some families through. Yes, why am I telling this story? I'm telling it because I know Michelle asked the question, and I know that particular question has been asked for years. And I think there's something really true about piloting something, starting small, managing it, maybe making adjustments along the way, evaluating what you're doing, maybe changing direction or adding some supports, addressing some of the challenges, and then expanding the size of the pilot, and then shopping it around again to show the results, the outcomes, why, all the reasons why what you've been proposing makes sense, not only for our organization or the people we know, but for other parts of the province, perhaps other municipalities, maybe other demographic groups. So I tell this story in part because I think we learned a lot through this experience, but also I tell it because that's where my hope comes from. It comes from action that can lead to change. And I think about all the people we work with who don't have hope. And I guess I can only continue to do this work if I too have hope and believe that things can get better, that we can offer people safety and security and choice and dignity, and work with them to affect change in their lives and in their unhoused situations. So yeah, I don't know that I necessarily touched on anyone's particular presentation, but when I saw that one question go across the screen, I thought it was really important because, Michelle, we have been asking that particular question for at least 15 years, and I don't think we've yet found a way to affect change around it. Thank you.
Thank you very much, Sheri. That's really important to have some hope in these difficult times. I was just looking at the questions, and to get back to Michelle's question, perhaps I could follow up a bit with you and maybe go back to the others. She asked, what can we do to convince the government that we need supportive housing for people living with mental health issues and addictions, and that we need them to act now? In relation to what you were talking about, Sheri, you said you gave people, the support services and so on. Were they for mental health or addictions? I mean, it strikes me that there are a lot of backup services that are needed to follow your model. And then I guess maybe a supplementary question to that in terms of what you're proposing, or what you've been doing, which is great, but how could that be ramped up? How could that be ramped up in terms of, sorry, I've lost my picture somehow. How could it be ramped up for other organizations or more generally in terms of the issues?
Did you say ramped up?
Ramped up, as in, more of that kind of way of working.
So we're sharing our learning with some communities. I don't know whether or how they'll be able to take them forward. I think it's also really important to remember that many of the people who I referred to, that by name list of individuals and families, there is an overrepresentation of Indigenous individuals and families on that list. There's also an overrepresentation of African descended individuals and families. And I think it's really important that that for those populations and those communities, that on this issue in particular, we can share what we've learned, we can share the model, but it's not for us to come with the solution. If a community would want to do something, or to not replicate, but make it their own, it would be really important for them to do it in a way that's, that makes sense and is appropriate for their community. In terms of the first question, absolutely, there were all kinds of needs. And so one of the responsibilities of either the social worker or the housing support worker working with the family was to, you know, the first thing is to provide a secure home. Like, how can you even start to address any of the other issues that might come up if you don't have security, if you don't know where you're sleeping tonight, if you're not together as a family unit in this case? You know, if your children are staying in 2 or 3 different places, or if for 6 months you haven't stayed in the same place, or you've moved from family member to family member, you can't actually address physical or mental health concerns. So once people are in a secure home environment, and we see this in our supportive housing as well, then it becomes possible to try to, in bite-sized pieces, address all of the other issues. But you know, you have to hang in. This is not something that gets wrapped up in 2 months or necessarily in 2 years. It can sometimes take years for people to build the relationships and find the healing that will lead to you know, a much looser relationship, or using fewer supports. I would say that we don't have the health supports at the table that we are always needing.
Okay, thanks Sheri, for that answer. It seems to me, you know, we need housing first, and more of it, and then we need the upstream approach, services that back that up. Perhaps that's one thing we can take out of that. There's a question here from Amy LaPlante. She says, how many people above the 390, I think you said 490, but anyway, homeless in Halifax are not just not visible people couch surfing, living in tents, cars in the woods, rapid housing? I'm not sure what rapid housing means. Maybe somebody could clarify. So that's one part of the question. Maybe Jeff or Linda, maybe Linda, do you know those numbers? How many people are couch surfing, living in tents? Anybody? Linda, want to try that?
I'm not sure of the exact numbers. The Sheri spoke of the by name list. Yeah, I can't tell you. I don't know, Jeff and Sheri, if either of you know the exact numbers.
Well, we did, housing workers and the street outreach worker did a very informal survey in late summer, and there were approximately 50 individuals that were sleeping rough, like core rough, like nowhere but in the woods, in tents, on sidewalks, that they knew of. So that's an initial stab. We never have a good sense of those who are, you know, sleeping rough, or who are couch surfing, or squatting. But if we take 50 as the starting point, you know, my sense would be there's probably, you know, good 150, 200 people that could use shelter space if it was provided.
Okay, thanks, Jeff. There's a somewhat related question here. Maybe you could start with it. Since COVID is still with it, it's from Kim Mundle, sorry. since COVID is still with us and the capacity at the existing shelters has been reduced, what is happening now with the people who cannot obtain a shelter bed or housing? Is there a plan? Who is responsible for meeting this need? So I guess, I don't know, Jeff, whether you've been involved with any of the discussions with the province. I think probably Linda has, but either, Jeff, you start and then we'll go to Linda and Sheri. And anybody of the any of the panelists too, would like to answer that. Go ahead.
I mean, I know Sheri and Linda are around lots of tables with me and not with me. We at Out of the Cold, which has deep connections with Linda and Sheri as well, are hoping to open up something that will hopefully alleviate some of the folks that can't go anywhere else. If that means like a 20-bed, a 25-bed space. Oh, by the way, Out of the Cold did ask if I would ask if anybody knew of any places where we could open up an emergency winter shelter in the next month. But we have a couple leads and we're working on that. We are around the table with the province, thinking through some other alternatives. Last year it was hotels. We know that hotels are available still. I don't know if that's the route that the province will go. We all know that more supportive and affordable housing is the answer. There's there are discussions around modular housing right now. There are discussions around small little spaces that have been picked up by organizations that can house 5-7 individuals for a 6-month period or something. There's talk about maybe exploring kind of a shared accommodation space. So there's a lot of pieces out there. But whether, this is the frustration, is that we all know what's needed. It just seems so difficult to get the units available when we need them. We have such skilled, talented folks that can do such great wraparound supports for individuals who need them once units are set, but it just seems so difficult to get these units. And that's I'm just talking urban, so I know, we've already had some great speakers here around the rural constraints.
Okay, thanks, Jeff. Do you have anything to add to that, Linda?
I guess, well, first of all, I would say Jeff did a very good description about what is going on exactly. I guess what keeps coming to my mind, though, is, people are used to the same voices. You heard them again tonight. And it seems to me that politicians want to be reelected, and they act on what they believe the voters want. And it's the same people, as Jeff just said. We're around the same tables talking to each other all the time, or most of us, or some of us, or it seems to me that more people, and I think it needs to be members of the general public, take the time to learn about it and talk about it, and talk to people of influence about it, because we're becoming, as Jeff said, we all know what needs to be done, and it shouldn't be this hard. It's basic human rights. It's not even anything extreme, but it just shouldn't be this hard.
Yeah, thanks, Linda. Before I go to the next question, which I have in my mind, perhaps I'd like to ask Karen and Trish, is anything being done, or Catherine up in Cape Breton, and Karen, is anything being done in Cape Breton currently in terms by the province, by the municipality, in terms of increased homelessness up there as the winter comes along, as the second wave of pandemic comes along, probably? Karen, do you want to go first?
I think we've lost Karen, actually.
Okay, all right, thanks. So is Catherine there? Catherine, are you still there? Have we lost Catherine as well?
No, there she is.
Great, thanks.
Oh, we don't have your sound though. I'm not sure, Catherine, we're not hearing you there. It looks like your sound's on. So maybe we can jump to Trish and I can see what I can see in the back end here. Sorry, Trish, maybe we can address that question to you in terms of homelessness in rural areas and moves that any of the municipalities have been making around contributing to that. All right, seems to be.
No.
All right, so maybe Stella, we can move on.
She's not able to connect. Okay, so I'd like to move back to Catherine, given what Jeff and Linda just said. Linda specifically about that politicians need to hear from the rest of us. And Catherine, you said that we need to be better connected across the province. Trish raised some questions about that in terms of, you know, the need to respect diversity across the province, the different needs in the different communities, rural, urban, and so on and so forth, and Indigenous, non-Indigenous, and so on. Do you have anything to tell us about that, how we might go about that? Partly because I do think connection would allow more of us to get involved. It would allow more of us to know more about what's going on. I mainly work on income assistance issues, and I can tell you that's a bit of a nightmare and takes a long time to get your head around. But I think housing is even more, it's even more the case for housing. So would you like to address that question, Catherine?
Sorry, Catherine, we're still not hearing you for some reason.
We can see you, but we can't hear you.
Not sure.
You've not got her on mute, Alec, have you?
Nope, mic's on.
Can't find your mic?
Not sure what's happening there, Stella, so maybe we can move on to another question.
Okay.
Mine had completely frozen, so I'm now on my phone.
Oh, we can hear you though. Go ahead. Go ahead, Trish.
So you were, can you repeat what you were asking? I was so busy trying to.
Yes, sorry. I was asking that Linda was saying that, and Catherine had said earlier, it's we need to be better connected across the province. And I was commenting that, you know, Linda said that, you know, more of us need to get involved so that politicians hear us. But it's difficult to do that if we can't be connected and really know what's going on. Those of us who are not directly involved in housing, you know, as service providers. So how would you were concerned about, you know, ensuring the diversity, rural, urban, and then there's Indigenous, non-Indigenous, diverse populations. So I was asking you to address that. You know, how do you think it's worth trying to be more connected, and how would you propose that we ensure that the different voices are there at the table?
Yeah, I definitely think it's worth trying to be connected. I think that having that larger group and larger voice is definitely helpful. I guess I just always bring it up as a point of making sure that there are enough voices at the table representing those other more, you know, unique challenges that aren't the same at all as what you see in Central Region. So, you know, whether it be housing or another topic, just making sure that, and it's not just one token voice at the table, but that you've got enough people at the table that they can actually be heard, that there are challenges. You know, when you're in a rural community, yes, it's a much smaller population, but the challenges are almost magnified because of the physical distance from so much that's there. And often the government side of things is so centralized that they're not even thinking about anything outside of Halifax.
Okay. Thanks, Trish. I think that's given us something to think about and maybe talk about around the Nova Scotia Action Coalition table. We have just a couple of minutes left. Kim Mundell asks, what are the barriers to obtaining units? I think he's talking about I'm not sure it's talking about units. What can the general public to move this forward? I think we've maybe already answered that question to some extent. And then Joy Polly asks, municipalities rely on property taxes for their budgets. They're quite excited about high value developments that often are too high in rent for the general population. How do we convince them to focus on lower rental properties? Would anybody like to try that question? I guess Catherine's still incommunicado, is she? Yes, I don't hear any. I don't know what the answer to that question would be. Is Sheri around still? Do you have any comments on that?
So the question is how to get them to focus on low income rental.
Yeah.
So you know, I think it's really clear. We know what the numbers are around core housing need. One of the conversations, or one stream of the conversation, has been having more support and more investment in current and in growing the nonprofit housing provider sector. It's really important. We have some nonprofit we have housing that we own. I know there are others on this call and across HRM and other communities that have housing, but there hasn't been the kind of investment in us and support. So if we're renting units for $535, and someone is going down the road with a rent supplement of $200 or $400 on their $535 to rent from a private developer or a private landlord, then, you know, where do we as nonprofit housing providers get the money to keep to maintain our units and to properly look after and to plan for replacement of the roof and all the other things that need to happen. So I would say that that's something I've been talking about it for years. It's really important because when a private developer, let's say, agrees to X number of units, it's for a number of years. And then when, let's say, the 15-year agreement is up, that housing, that lower rented housing is gone from the community. But if a nonprofit housing provider has an agreement for 15 years, when the 15 years are up, they continue to rent it at lower rates, at lower rents that people can actually afford. Because we know that if we put the rent up, our tenants can't afford them. So that is one thing that I think would be really important at, particularly at the provincial level, to see more investment and more support for. I suspect that most of us at most are getting $535 per unit if we're getting that. And that's what the private landlords are getting.
Yeah, thanks, Sherry. And I know that this, as you say, the 535 kind of amount is about what people on income assistance get if they're lucky. So, you know, that we, you know, on income assistance, that the people are facing more evictions, more rent increases and so on. So it's a multiple impact. Upstream is what I've been saying to people, you know, and now it's coming downstream. Anyway, I'm afraid our time is coming to a close.
Sorry, Stella, maybe we think we have Catherine working, so maybe we can just give Catherine a few minutes to address.
All right,
hey,
if we've got extra time, that'd be great.
Well, can you hear me now?
We can, yes.
Yeah.
Yes.
Thank you.
Okay, that's great. Wow, sorry about that. Yeah, so I, you know, to your question about, you know, is connecting more needed? Is it worth connecting versus focusing on having the general public raise awareness and approach decision makers? I know I'm not entirely or perfectly capturing what has been said, but you know what the answer or the question I want to answer anyway. I think it's, you know, I'm not sure if we're always talking to the same people. So I know that people are well connected in particular geographies, but you know, this is the first time that I'm meeting people like Trish and Sheri and Jeff and others, and it's been very valuable for me, and you know, and hopefully it's been valuable for you as well. I think that it's easy for the province to say no to our requests because they can say, well, if we do this for your area, we have to do it across the province, or we can't just focus on Halifax. But I think that's an easy way out, because then they can say, well, we're not going to do it at all because we can't just focus on Halifax. I think that we're stronger together, and I think that there's more in common than not. I think we have in common that we have tenants experiencing core housing need. We have in common that we have homelessness in our communities. We have in common that we need more supportive housing, and we need health supports for our tenants. Yes, we have differences. You know, the barriers that Trish was mentioning around transportation and lack of services, we have those here too in our own municipality. You know, there's no transit to Lewisburg, there's no transit to Eskazoni or to New Waterford. We have an incredible, actually, we're quite lucky in CVRM in some ways compared to more rural communities, but we don't have services here that people living in supported housing, you know, had in the, that they have access to in bigger communities. So, you know, Trish, you and I have that in common as far as where we're living. But I do wonder if it's easier for the province to say no to our requests when we can't, as a sector, province-wide, make certain requests to them.
Thank you very much for that, Catherine. I think that's very important. It will take a lot of work to get to that point for all of us, I think, and maybe we can move forward in that direction. I certainly hope so. You know, the system is getting, you know, Halifax wanted to be a big city. Well, now we're a big city and we've got all the big city problems, but you know, they're not limited to Halifax, as you say, and there are different issues too around transportation and all those other issues in the rural communities. So I think we do need those conversations. Anyway, I think we should wrap it up now. And thank you everybody for your challenging and very interesting discussions, both speakers and panelists. As we've seen, I don't think this should be the end of our discussion at all. And our Nova Scotia Action Coalition for Community Wellbeing and our working groups and our members will be monitoring this situation and no doubt continuing our advocacy work on affordable housing and related issue. If anybody is on the line who's interested, is not a member of our coalition, is interested in considering joining or on being one of our working groups. We have 2 working groups at the moment, one on income security, which is mainly income assistance, which I coordinate, and one on affordable housing and homelessness, which Colleen Cameron coordinates. If you're interested in being involved, please do contact us. The contact information is on the website, as is our goals and values and so on. So please do look at the website. As I said, this webinar is being recorded and will be on the Facebook page and on the website. And we'd invite everybody to send it around as far and wide as you can so that we get more people knowledgeable about the issue. I think that's really at least a start anyway. So thank you, everybody. We'll see you later, I hope. Willaliok. I've been practicing that all day.
Thanks, Stella.
Thanks a lot. Bye-bye.
Nice meeting you all. Thanks.
Yeah, and you.